Hello friends, welcome back to our channel Aminia Dental Tutorials. Today we are going to learn about the topic sandwich technique. Actually, sandwich technique it is a process of restoring a prepared tooth by initially placing a layer of type 2 GIC. This is done for fluoride release, followed by an overlying layer of resin based composite. This is done for strength and durability. This is known as sandwich technique. This is dentin. This is the composite resin. This composite resin it doesn't bond to dentin adequately. Therefore, during polymerization, a gap results if the cavity margin is situated in dentin. A gap results. This gap is filled by GIC. This bond can be improved by placing GIC liner in between this composite resin and dentin. In between composite resin and dentin, we are placing a GIC layer so that bond can be improved. This GIC, it bonds to dentin through chemical adhesion. It binds to composite resin through porosities present on GIC liner. This composite resin doesn't bond adequately to dentin. Therefore, during polymerization, a gap results, which is filled with GIC. This GIC binds to dentin through chemical adhesion, and this GIC binds to composite resin through mechanically through porosities present on surface of GIC. This glass ionomer cement, it can also be etched with help of phosphoric acid to improve the retention. This GIC also provides anti-karyogenic effect. It also provides anti-karyogenic effect because of its fluoride release. Therefore, when used in this context, it is often referred to as sandwich technique.